anchorwoman Jennifer Losek, and I'm here with Melissa Sullivan and her nurse Margaret, and we're here with her because of a hypertensive crisis. Melissa, can you tell us what happened leading up to being in the ER?
I suddenly had a headache that just wouldn't go away, and the dizziness started. I felt sick to my stomach, and it was all I could do to not get sick everywhere. When the Tylenol and Pepto-Bismol stopped working, I knew I needed to go to the ER.
So was it kind of like a migraine?
Sort of. I just felt so weak, and I hurt everywhere.
Have you ever heard of a hypertensive crisis before?
I have. My doctor told me about it when I first got diagnosed with high blood pressure. He told me it was important to take my medication so my blood pressure got controlled. I quit smoking too. He said that smoking, poor diet, and sitting around all day weren't helping my situation.
Okay. And Margaret, what puts a person at risk for a hypertensive crisis?
Well, it's exactly what Melissa said. It could be smoking, poor diet, sedentary lifestyle, people overweight, all put a person at high risk for high blood pressure and possible hypertensive crisis. Patients who have already been diagnosed with hypertension in our categories with stage 3 hypertension are even greater risk due to severity of their condition. Studies have also shown that certain races, such as African Americans, have a higher prevalence of hypertension, which correlates them to having higher incidences of hypertension crisis.
And does age play a role in hypertension?
It sure does. As a person gets older, their heart and blood vessels stop working as efficiently, and there's a higher risk for plaque buildup in the arteries, which can lead to high blood pressure.
And what does it mean for a person who's having a hypertensive crisis?
When a person's blood pressure suddenly increases, it can be classified in 2 categories: hypertensive urgency or crisis. In an urgent situation, the blood pressure still jumps, but the diastolic number is usually below 120. The patient may have some chest pain, which is called stable angina. Vitals are also stable, and there is no damage being caused in the internal organs. In a crisis, the diastolic number is at or higher than 120. There is also damage occurring to internal organs. Hypertension already increases a person's risk for stroke, coronary artery disease, heart failure, kidney disease, peripheral vascular disease, and heart attack. In a crisis, the risk of these are increased significantly.
So Melissa, when you came to the ER, what happened?
I was put on a machine that took a look at my heart, and the nurses drew a lot of blood. I was given medications as well, which the doctor told me was supposed to lower my blood pressure.
For Melissa, we tested her blood for potassium, sodium, creatinine, and fasting glucose, and her overall cholesterol levels.
And what kind of interventions would you do, or would the doctor do?
A doctor will prescribe medications to help lower the blood pressure, as well as treat any symptoms caused by the crisis. A doctor will have a patient do a cardiac stress test. The doctor will also refer the patient to a dietitian and any other specialists depending on what kind of organ damage had occurred during the crisis. Once a patient is stable, the doctor will order a follow-up visit.
And what would you do as the nurse?
A lot what we do comes into play after the patient has become stable and is recovering. During the crisis, we'll obviously do as the doctor asks: administer medications, get blood and urine samples, and place the patient on the ECG. A huge part of our job is making sure the patient is comfortable as well, whether this means reposition the patient in bed to make him comfortable or helping him relieve associated pain through non-pharmaceutical treatments, such as ice packs, dimming the lights. Once a patient has become stable, we do a lot of education on the importance of taking blood pressure medications and making lifestyle changes in order to help them bring down the patient's blood pressure. The patient then will be put on a low-sodium diet, specifically the DASH diet. The DASH diet is a specialty diet to help lower the blood pressure through healthy eating. If needed, we will help patients find other resources in outpatient services.
Well, thank you, Margaret and Melissa, for your candid input on hypertensive crisis. I'm anchorwoman Jennifer Losek at Lourdes University, and this is your news on the best current health.